Hello, everyone, and welcome back to your daily dose of English, where learning English is easy, fun, and practical for your everyday life. I'm Tom.
And I'm Sarah. Hello, Tom, and hello to all our wonderful listeners out there. How are you feeling today, Tom?
I'm feeling great, Sarah. Thank you for asking. Actually, that's a perfect way to start today's episode, because we're going to talk about something really important. We're talking about going to the doctor's office and how to communicate when you're not feeling well.
Oh, this is such an important topic. I know many of our listeners feel nervous about visiting the doctor in English. It can be scary when you're not feeling well, and you also have to speak in another language.
Absolutely. And before we dive in, we want to ask you all for a small favour. If you're enjoying our podcast, please take a moment to subscribe to your daily dose of English. Hit that subscribe button.
Yes, and don't forget to give this episode a like and share it with your friends who are learning English. Your support really helps us create more content for you. And please leave us a comment below telling us about your experiences at the doctor's office in English.
Okay, Sarah, let's be honest. Have you ever felt nervous about going to the doctor in English?
Oh my goodness, yes! I remember the first time I had to make a doctor's appointment by phone in English. My heart was beating so fast. I was worried I wouldn't understand the receptionist or that I would forget important information.
That's so relatable. I think everyone who has lived in a new country understands that feeling. The doctor's office can be stressful even in your native language, but in English, it feels like a whole new challenge.
Exactly. But here's the good news. Today, we're going to break it down step by step. We'll start with making an appointment, then checking in at the reception, describing your symptoms, understanding the doctor's questions, and finally, understanding treatment instructions.
Perfect. Let's start at the very beginning, making an appointment by phone. Sarah, what's the first thing you need to do when you call a doctor's office?
Well, the receptionist will usually answer and say something like, "Good morning, Dr. Smith's office. How may I help you?" This is your cue to explain why you're calling.
Right. So you can say, "Hello, I'd like to make an appointment, please." Or if it's urgent, you can say, "I need to see the doctor as soon as possible." The key phrase here is, "I'd like to make an appointment."
Yes, and then the receptionist will ask you some questions. They might ask, "What is the reason for your visit?" Or, "What seems to be the problem?" Don't worry, you don't need to give all the details on the phone. You can keep it simple.
Good point. You can say things like, "I have a sore throat," or "I've been having headaches," or "I have a fever." Just a brief description is fine. The detailed conversation will happen when you see the doctor.
Exactly. After that, the receptionist will look at the schedule and offer you some appointment times. They might say, "We have an opening on Thursday at 2 p.m. Does that work for you?"
And this is where it's important to listen carefully to the day and time. If you're not sure you heard correctly, don't be afraid to ask them to repeat. You can say, "I'm sorry, could you repeat that, please?" Or, "Did you say Thursday or Tuesday?"
That's such good advice, Tom. It's always better to ask for clarification than to write down the wrong information. And here's another useful phrase. If the time doesn't work for you, you can say, "I'm sorry, I'm not available at that time. Do you have anything earlier? Or do you have any appointments in the morning?"
Perfect. And before you hang up, make sure you have all the important information. the receptionist will usually give you the doctor's name, the date, the time, and the address if it's your first visit.
Yes, and it's a good idea to write everything down immediately. You can even repeat it back to them to make sure you got it right. You can say, "So, that's Thursday, March 15th at 2 p.m. with Dr. Smith. Is that correct?"
Excellent practice. Now let's move to the next step. You've made your appointment and now it's the day of your visit. You arrive at the doctor's office. What happens at the reception?
Well, you need to check in. You walk up to the reception desk and the receptionist will usually say, "Hello, how can I help you today?" You can respond with, "Hello, I have an appointment at 2 p.m. with Dr. Smith." Or, "I'm here for my 2 o'clock appointment."
And this is very important, Sarah. If it's your first time at this doctor's office, they will ask you to fill out some forms. They might say, "Is this your first visit?" And you answer, "Yes, it is." Then they'll give you a clipboard with forms.
These forms can look intimidating, but don't worry. They usually ask for basic information like your name, date of birth, address, phone number, and emergency contact. They also ask about your medical history.
Right. Medical history questions include things like do you have any allergies? Or are you taking any medications? Or have you had any surgeries? It's a good idea to prepare this information before you go to the doctor.
Absolutely. Write down the names of any medications you take, any allergies you have, and any medical conditions. Bring this list with you. You can even write it in English at home when you have time to use a dictionary.
Great tip. And don't forget to bring your insurance card and ID. The receptionist will need to make copies. They might say, "May I see your insurance card, please?"
After you check in and fill out the forms, you'll sit in the waiting room until they call your name. When they call you, you'll follow a nurse to the examination room. This is when things get more detailed.
Yes, this is the important part. The nurse will usually take your vital signs first. Do you know what vital signs are, Sarah?
Yes, vital signs are basic measurements of your health. The most common ones are your temperature, blood pressure, and pulse. The nurse might say, "I'm going to take your temperature," or "Let me check your blood pressure."
And you don't need to do anything except sit still and follow their instructions. They might also ask you to step on a scale to check your weight. They'll say, "Please step on the scale for me."
After taking your vital signs, the nurse will ask you the main question: "What brings you in today?" This is your opportunity to explain why you came to see the doctor.
This is where knowing how to describe symptoms becomes really important. Let's talk about some common ways to describe how you feel. Sarah, what are some useful phrases for describing pain?
Great question. Let's start with the types of pain. You can say, "I have a sharp pain," which means it's sudden and intense. Or you can say, "I have a dull ache," which means it's a continuous, less intense pain.
Right. And you can describe where the pain is located. For example, "I have a pain in my chest," or "My stomach hurts," or "I have a headache," or "My throat is sore."
You can also describe when the pain happens. You can say, "It hurts when I swallow," or "The pain gets worse at night," or "It hurts when I move my arm."
These are all very useful. And here's another important thing. Doctors often ask about pain levels. They might ask, on a scale of 1 to 10, how bad is the pain? 1 means very little pain, and 10 means the worst pain imaginable.
So you can say, "It's about a 5," or "It's pretty bad," maybe a 7 or 8. This helps the doctor understand how serious your symptoms are.
Exactly. Now let's talk about other common symptoms besides pain. What if you have a fever, Sarah?
You can say, I have a fever, or I feel feverish, or I think I have a temperature. You can also say, I've been feeling hot and cold, which means you have chills.
And what about coughing? That's a very common symptom, especially during cold season.
Yes, you can say, I have a cough, or I've been coughing a lot. You can also describe the type of cough. Is it a dry cough or a wet cough? A dry cough means there's no mucus. A wet cough means there is mucus.
Good distinction. What about feeling tired or weak? How do you describe that?
You can say, I feel exhausted, or I feel very tired, or I don't have any energy. You can also say, I feel weak, or I feel dizzy.
And here's a very common phrase that native speakers use. I'm not feeling well. This is a general way to say you feel sick without describing specific symptoms.
That's right. Or you can say, I'm feeling under the weather, which is an idiom that means the same thing. It's a very natural, casual way to say you're sick.
Now, once you've described your symptoms to the nurse, the doctor will come in. The doctor will introduce themselves and then ask you more detailed questions about your symptoms.
Yes, the doctor needs to understand your complete medical history and exactly what's been happening. They might ask, how long have you been feeling this way? This is asking about the duration of your symptoms.
You can answer with phrases like, it started 3 days ago, or I've been feeling like this for about a week, or it started this morning.
The doctor might also ask, have you had this before? They want to know if this is a recurring problem. You can answer, yes, I had this last year, or no, this is the first time.
Another common question is, are you taking any medications? This is very important because the doctor needs to know if your current medications might interact with new ones they want to prescribe.
Right. And they'll ask, do you have any allergies? Especially allergies to medications. This is crucial information. If you're allergic to penicillin, for example, you need to tell them. You can say, yes, I'm allergic to penicillin.
The doctor might also ask about your lifestyle. Questions like, do you smoke? Or do you drink alcohol? Or do you exercise regularly? These questions help them understand your overall health.
After asking all these questions, the doctor will do a physical examination. They might say, I'm going to examine you now, or let me take a look. They might listen to your heart and lungs with a stethoscope.
They'll probably say things like, take a deep breath, or breathe normally, or say ah. These are simple commands that you need to follow.
If they need to examine a specific area, they might say, does this hurt? While they press on your stomach or another part of your body. You just answer yes or no.
After the examination, the doctor will explain what they think is wrong. This is called a diagnosis. They might say you have a throat infection, or it looks like you have the flu, or I think you have bronchitis.
Now, here's the important part. Sometimes doctors use medical terms that are difficult to understand. Don't be embarrassed to ask for clarification. You can say, I'm sorry, I don't understand. Can you explain that in simpler terms?
Absolutely. Or you can say, what does that mean? Or, could you repeat that, please? Doctors are used to explaining things and they want you to understand your health.
After explaining the diagnosis, the doctor will talk about treatment. This is another crucial moment to listen carefully. They might prescribe medication, suggest rest, or recommend certain treatments.
Let's talk about prescriptions. If the doctor writes you a prescription, they'll explain how to take the medicine. They might say take 1 pill twice a day, or take this with food, or take this before bedtime.
The key words to listen for are how many, how often, and when. 2 pills tells you how many. 3 times a day tells you how often. After meals tells you when.
And here are some important questions you should ask about medication. Are there any side effects? Side effects are negative reactions you might have to the medicine.
Right. The doctor might say, this might make you drowsy, which means sleepy, or you might feel nauseous, which means you might feel like you want to vomit.
Another important question is, how long should I take this medication? The doctor will tell you if it's for a few days, a week or longer.
You should also ask, can I take this with my other medications? If you're already taking other medicine, the doctor needs to make sure there are no dangerous interactions.
Good point. And if the doctor recommends rest or other non-medication treatments, make sure you understand those instructions too. They might say, get plenty of rest, or drink lots of fluids, or avoid strenuous activity.
These instructions are just as important as taking medication. Get plenty of rest means sleep more than usual. Drink lots of fluids means water, juice, or tea to stay hydrated. Avoid strenuous activity means don't exercise or do hard physical work.
Before you leave the doctor's office, make sure you know if you need a follow-up appointment. The doctor might say, come back in 2 weeks, or if you're not feeling better in 5 days, call us.
You can also ask, when should I start feeling better? Or what should I do if the symptoms get worse? These are very reasonable questions.
And here's one more important phrase. Should I go to the emergency room if... and then describe a worrying symptom. The doctor will tell you what symptoms are serious enough to go to the emergency room.
Absolutely. For example, you might ask, should I go to the emergency room if I have trouble breathing? The doctor will give you clear guidance on when to seek emergency care.
Okay, so we've covered a lot of ground here. Let's do a quick review of the most useful phrases for each step of visiting the doctor.
Great idea. For making an appointment, remember these phrases. I'd like to make an appointment. I need to see the doctor as soon as possible. And could you repeat that, please?
For checking in at reception, I have an appointment at 2 p.m. Is this your first visit? And may I see your insurance card?
For describing symptoms, I have a pain in my... It hurts when I... On a scale of 1 to 10, the pain is... And I've been feeling this way for...
For understanding the doctor's questions, how long have you been feeling this way? Have you had this before? Are you taking any medications? And do you have any allergies?
For treatment instructions, take 1 pill twice a day. Take this with food. Get plenty of rest and drink lots of fluids.
And for asking clarification, I'm sorry, I don't understand. Can you explain that in simpler terms? What does that mean? And could you repeat that, please?
These phrases will help you feel so much more confident at the doctor's office. The key is preparation. Before you go, write down your symptoms, your questions, and any medications you're taking.
That's excellent advice. And remember, doctors and nurses want to help you. They're not judging your English. They just want to understand how you feel so they can give you the best care.
So true. Don't let language anxiety stop you from getting medical care. Your health is the most important thing.
Now let's talk about some cultural differences that might be helpful to know. In many English-speaking countries, especially the United States, Canada, the UK and Australia, it's very common to be direct with your doctor.
Yes, you don't need to be overly polite or shy about describing symptoms. The doctor needs clear, honest information. If something hurts, say it hurts. If you're worried about something, tell them.
Right? And in these countries, patients are encouraged to ask questions. In fact, doctors appreciate when patients ask questions because it shows you're engaged in your own healthcare.
That's a really good point. Don't feel like you're bothering the doctor by asking questions. It's their job to answer your questions and make sure you understand your treatment.
Another cultural note. In English-speaking countries, medical appointments usually run on schedule. If your appointment is at 2 p.m, try to arrive about 10 to 15 minutes early to check in. Being on time is important.
Yes, and if you're running late, it's polite to call the office and let them know they might need to reschedule your appointment.
Okay, I think we've given our listeners a really comprehensive guide to visiting the doctor in English. Sarah, do you have any final tips?
Yes, I have a few. First, consider bringing a friend or family member with you, especially for your first visit. They can help you understand if you miss something the doctor says.
That's a great idea. And second, don't be afraid to write things down during your appointment. Bring a notebook and pen. When the doctor tells you something important, write it down immediately.
Exactly. You might think you'll remember everything, but when you're feeling sick or nervous, it's easy to forget details. Writing it down helps.
Third tip. If English is not your first language, you can actually request an interpreter in many hospitals and doctors' offices. They can provide this service often for free.
That's very true. And finally, remember that practice makes perfect. The more you visit doctors and use these phrases, the easier it becomes.
Well said. And to help you practice, we've created a special vocabulary review of all the medical terms and phrases we discussed today. Let's go through some of the most important words.
Let's start with body parts and symptoms. Throat, that's the part inside your neck. My throat is sore means your throat hurts. Stomach, that's the organ where food goes after you eat. My stomach hurts is a very common complaint.
Chest, that's the front part of your body between your neck and your stomach. Your heart and lungs are in your chest. I have chest pain is a serious symptom that you should always report immediately.
Temperature, that's a measurement of how hot your body is. Normal body temperature is about 98.6 degrees Fahrenheit or 37 degrees Celsius. If your temperature is higher, you have a fever.
Fever, that's when your body temperature is higher than normal, usually because you're fighting an infection. I have a fever means you feel hot and might be sweating or shivering.
Cough. That's the sound and action when air is forced out of your lungs suddenly. I have a cough or I'm coughing are both correct ways to say this.
Dizzy. That's the feeling that the room is spinning or that you might fall. I feel dizzy is important to tell your doctor because it can indicate various problems.
Nauseous, that's the feeling that you might vomit or throw up. I feel nauseous or I feel sick to my stomach mean the same thing.
Now let's talk about some medical vocabulary. Symptom, that's a sign that something is wrong with your health. Pain, cough, and fever are all symptoms.
Diagnosis, that's the doctor's conclusion about what illness or condition you have. The diagnosis is a throat infection, means the doctor has determined that you have an infection in your throat.
Prescription, that's a written order from a doctor for medication. You take the prescription to a pharmacy to get the medicine.
Medication or medicine, those are substances you take to treat an illness. Pills, tablets, and capsules are all forms of medication that you swallow.
Side effects, those are unwanted effects that medication might cause. For example, a side effect of some medicines is drowsiness, which means feeling sleepy.
Allergic, that means your body has a bad reaction to something. I'm allergic to peanuts means peanuts make you sick.
Examination, that's when the doctor looks at you, touches you, or uses instruments to check your health. Physical examination or medical examination mean the same thing.
Follow-up appointment, that's a second appointment after your first visit. The doctor wants to see you again to check if you're getting better.
Now let's look at some useful phrases for the pharmacy, because after you see the doctor, you'll probably need to get your medication.
When you go to the pharmacy, you'll say, I have a prescription to fill. Fill means to get the medication that the doctor prescribed.
The pharmacist might ask, is this a new prescription or a refill? A refill means you've taken this medication before and you need more of it.
They'll also ask, do you have any questions about this medication? This is a great time to ask how to take it if you're not sure.
The pharmacist will explain, take 1 tablet twice daily with food. Daily means every day. Twice daily means 2 times each day.
They might also say, this medication may cause drowsiness. Don't drive or operate machinery. This is a warning about side effects.
Another phrase you might hear is, complete the full course of antibiotics. This means take all the pills, even if you start feeling better before they're gone.
Wow, we've covered so much today. I feel like our listeners are now well prepared for their next doctor's visit.
Me too. And remember everyone, your health is precious. Don't let language barriers prevent you from seeking medical care when you need it.
Absolutely. And the more you practice these phrases and use them in real situations, the more confident you'll become.
Before we finish, let's do a quick role play to put all of this together. Sarah, let's pretend I'm the patient and you're the doctor. I'll show everyone how to use these phrases in a real conversation.
Great idea. Okay, I'm Dr. Sarah. Come on in and have a seat. So, Tom, what brings you in today?
Hello, Dr. Sarah. Well, I haven't been feeling well for the past few days. I have a really sore throat, and I've been coughing a lot.
I see. How long have you had these symptoms?
It started about 3 days ago. At first it was just a little scratchy feeling in my throat, but now it really hurts when I swallow.
Okay. And what about the cough? Is it a dry cough or are you coughing up mucus?
It's mostly dry, but sometimes in the morning there's a little bit of mucus.
All right. Do you have a fever? Have you felt hot or had chills?
I felt a bit feverish yesterday evening, but I haven't checked my temperature.
Okay, no problem. We checked it when you came in and it's slightly elevated at 99.5. Have you had any other symptoms? Headache? Body aches? Difficulty breathing?
Yes, actually. I've had some body aches and I feel really tired all the time, but no difficulty breathing.
Good. Are you taking any medications currently?
Just vitamin D supplements, that's all?
And do you have any allergies to medications?
No allergies that I know of.
Perfect. Let me examine your throat. Open your mouth and say, "Ah," for me. Okay, yes, your throat is quite red and inflamed. I'm going to listen to your lungs now. Take a deep breath in and out. Good. Your lungs sound clear. Based on your symptoms and my examination, I think you have a viral throat infection, possibly the start of a cold or flu.
Is that serious? Do I need antibiotics?
No, this is viral, so antibiotics won't help. Antibiotics only work for bacterial infections. I'm going to recommend some over-the-counter medications for your symptoms. Take ibuprofen for the pain and fever, and you can use throat lozenges for the sore throat.
Okay. How often should I take the ibuprofen?
Take 400 milligrams every 6 hours as needed for pain or fever. Make sure you take it with food to protect your stomach.
Got it. And how long will this last?
Viral infections like this usually improve in 5 to 7 days. In the meantime, get plenty of rest, drink lots of water and warm liquids like tea with honey, and avoid strenuous activity.
Should I come back for a follow-up?
Only if your symptoms get worse or if you don't feel better in a week. If you develop a high fever over 102 degrees, difficulty breathing or severe pain, call us immediately or go to urgent care.
Okay, I understand. Thank you, Dr. Sarah.
You're welcome, Tom. Take care and feel better soon.
Perfect. That's exactly the kind of conversation you might have at the doctor's office. Did you notice how I described my symptoms clearly and asked questions when I wasn't sure about something?
Yes, and I really liked how you asked about antibiotics. That's a smart question because many people think they always need antibiotics when they're sick, but that's not true.
Exactly. Antibiotics are only for bacterial infections, not viral infections. This is important knowledge that can help you understand your treatment better.
And did everyone notice the useful phrases? I haven't been feeling well. It started 3 days ago. It hurts when I swallow. Do I need antibiotics? And how long will this last?
These are all natural, conversational phrases that native speakers use. You don't need to use complicated medical vocabulary. Just explain how you feel in simple, clear language.
That's the key to success at the doctor's office. Be clear, be honest, and don't be afraid to ask questions.
Well, I think that wraps up our episode for today. This has been such an important topic, and I hope our listeners feel much more prepared for their next doctor's visit.
Me too. Remember, everyone, taking care of your health is essential. And now you have all the English tools you need to communicate effectively with healthcare providers.
And before we go, we have a question for all of you. Please leave us a comment below and tell us, have you ever been to a doctor in an English-speaking country? What was your experience? What was the hardest part?
Yes, we'd love to hear your stories. Your experiences can help other learners who are preparing for their first doctor's visit.
And don't forget to subscribe to your daily dose of English. We release new episodes every week to help you improve your practical English skills for real-life situations.
Hit that like button if you found this episode helpful and share it with your friends who are learning English. You never know who might need this information.
Thank you so much for joining us today, everyone. We hope you learned a lot and feel more confident about going to the doctor's office.
Remember, your health comes first, and language should never be a barrier to getting the care you need. Keep practicing these phrases, and you'll be amazed at how natural they become.
Until next time, take care of yourselves and keep learning.
Bye, everyone. Stay healthy and see you in the next episode.
Goodbye.